The groundwork for this plan was established in 2005, and 196 countries signed up to it, and they're legally bound to participate in the drill, coordinated by WHO UN. It includes 2 exercises, including one for covering up the deliberate release of a virus. So they planned it to the T. This source is from A World at Risk, the Global Preparedness Board annual report, September 19. So it's been planning it for 15 years. That's the report out last year. And basically, they use doublespeak, so you've got to really interpret what they're saying, but they say the opposite of what they really mean to make truth sound more plausible. They use words in different ways from what we've used them, so you really have to drill down into the text to see what they're saying. But when you see words like exercise and drill, it reminds me of 9/11 and 7/7. There were exercises on, which was a great way to bring in a real live killing operation. So that's just an important item which I'm going to check up more on because I've only just seen it. But it sounds pretty bona fide to me because it's from the Global Preparedness Board. So just going to say a few things basically. Something I said last week that bears repeating. Can you spot the difference between the two statements made by government? The findings are hugely promising, but it is still too soon to know if this is enough to offer protection, and larger trials are underway. Second quote, the UK has already ordered 190 million doses of 3 vaccines. That's doublespeak, isn't it? So they've ordered 100 million of the Oxford vaccine, 30 million of the inactivated coronavirus, and 60 million of the BioNTech Pfizer vaccine. So millions of vaccines have been ordered. They've done it in America as well, for a virus with a 99% recovery rate. Either this is the most incompetent government in the world, or the vaccine orders are for a more sinister purpose than protecting you from a cold virus. The economy shattered, millions of people out of work, or will be when the furlough ends. And do you think your loving, caring government is incentivised to spend billions keeping you economically inactive people on benefits alive as long as possible? No. There's only one thing on their mind, and I'll leave it for you to conclude what that is. This is for any, especially for any nurses that are, or care workers that are in our group today. It's an anonymous message from a doctor, a consultant in a major hospital in Surrey, which includes an A&E department. And she says she's agreed to give an interview to the anti-lockdown activists, but will do so only anonymously because I've changed my mind about revealing my identity because of my family and various other personal things. Can't do it to them. But she says all staff, no matter what grade, at all hospitals have been warned that if they give any statement to the media, will be immediately suspended without pay. Certainly there's been no pandemic, certainly not in Surrey, and I've heard the same from colleagues across the country. Our hospital would normally expect 350,000 outpatients per year, around 95,000 patients admitted, and about 100,000 through A&E annually. In the months of March to June, we'd normally see 100,000 outpatients, 30,000 admissions, and 30,000 A&E. This year we're 95% down for that month, these months. In fact, the hospital has been pretty much empty for the entire period. The staff were questioned at the beginning, told we're being used as redundant capacity, kept back for the deluge that's to come. It never came. Given comments like, protect the NHS by senior managers, for the greater good. Repeatedly tested and counted as new cases. When people came in, they were tested second time, third time, the same person. So the figures are going to the Public Health England are exponentially inflated. The could be reported cases are 5 to 10 times higher than the actual number. There has been no pandemic, and explains why UK figures are much higher than the rest of Europe. The Trust has been running the ambulances during lockdown, driving with sirens and lights with no job to go to. Just gives the public the impression that there is a panic on. As soon as they're out of view, nurses, doctors, off come the masks, away goes the social distancing, and they just have a laugh about it. Indeed, they joke about it. I've heard staff express amazement that despite warnings on the packets telling people masks are totally ineffective and dangerous, the public still buy them because the politicians told them to. We've cancelled the vast majority of operations in all elective surgery. This tends to be emergency surgery, or that deemed urgent has been severely curtailed. The outcome of this is simple. People are at best denied basic treatment or are left to die. Regarding the death certificates, all staff responsible for this area have been told where possible to put COVID-19 complications as the reason for death. Even though the patient may have been asymptomatic or not even tested for COVID, it still goes down as COVID-19. What you actually die of in hospital is likely to be of other things other than COVID-19. And she says, I've included in my statement the published guidance from the government on how you should fill in a death certificate. Remember, COVID-19 itself cannot kill. What kills is complications from viruses like pneumonia. These complications are incredibly rare, but they're featured in death certificates in recent months. She says, there's been Thursday nights when I've stood alone in my office and cried as I heard the people cheering and clapping outside. It sickens me to see that NHS signs in the stolen rainbow that says for me, fear. There are many good people in the NHS. Most are in low pay and join, as we know from today's demonstration, and join for the right reasons, have been bullied and threatened if they don't stay on message. If they don't stay on message, they won't eat. Basically, they've been told these warnings. But if they could be given assurance of protection, there would be a tsunami of whistleblowers which would help end this brutal insanity. She says, I'm finding it increasingly hard to live with what I've been involved in, and I'm sorry this has happened. Politicians haven't changed. The country has made a fatal mistake in starting to trusting them without question. This virus misconception has been with us a long time. As insane as this social submission is, it's a chance to wake people up. Some go deeper into PPE, protection mode, but it's a chance to roll out multiple methods of control on society. Everyone must question government pronouncements. It's the healthy thing to do. And the White Coat Summit you saw in America, Washington DC, doctors came for a press conference to spell out about the myths surrounding coronavirus. All the media was there, CNN, NBC, New York Times, and they just wanted a simple message that the anti-malaria drug, hydroxychloroquine, was very effective. Dr. Stella Emanuel at the meeting said she treated over 350 COVID patients with hydroxy zinc and Zithromax, and they all recovered. And she and her staff were taking it also preventatively. So she yells out, there's a curse for COVID. There's a cure for COVID. You don't need a mask. So let's praise this brave woman and her colleagues for what they've done. Tremendous. Researchers in Toronto and Texas universities have found that whether a country was locked down or not was not associated with the COVID death rate. COVID-19 data from Europe, USA and China showed overall mortality were associated with comorbidities, and increased testing was not associated with the death rate. Going on to 5G, EMF waves are dangerous, can cause brain cancer, ADHD, brain fog, headaches. It's been mentioned in a new report by 3 universities, Marconi in Italy, Central Michigan in USA, and the first Moscow State University, that all compiled this report. Shows 5G millimeter waves could be absorbed by dermatological cells acting like antennas, transferred to other cells, They play a role in producing coronavirus. In biological cells, the DNA is built from charged electrons and atoms. The inductor structure is divided into linear, toroid and round inductors. Still with me? These inductors interact with external EM waves and produce extra waves within the cells. The waves produce holes in these bases. The bases join together to form virus-like structures such as coronavirus. To produce these viruses within a cell, it's necessary the wavelength of the external waves is shorter than the size of the cell. So 5G millimeter waves, new research, 3 universities, very good candidate for producing coronavirus. The research paper has since been withdrawn from the National Institute of Health. Surprise. And Dr. Stephan Lanka, I don't know if you know this lady, this guy, very good, German virologist. He says the virus misconception is at the heart of Operation Coronavirus, because without the concept of germ theory and without the horror story of a killer virus, most people wouldn't believe the official story in the propaganda. Dr. Stephan Lanka won a landmark case in the German Supreme Court where he proved that measles was not caused by a virus, no such thing as a measles virus. Dr. Lanka explains the history of how conclusions were made which demonised the humble virus and gave it pathogen status it doesn't deserve. Lanka says when scientists are working with diseased tissue, they think the presence of a virus is causing disease, instead of realising that the tissue they have has been isolated from its host, saturated with antibiotics, and the separation and poisons make it diseased and kill the tissue. It's not the virus that does it. All scientists who think they work with tissues are actually dealing with dying tissues or cells. They think the tissues and cells are infected by a virus, but they are dying because the tissues were starved and poisoned due to the experiments in the lab. The death of tissue and cells happens in the exact same way when no infected material is added at all. So to confirm so-called virus propagation, scientists should have conducted negative control experiments to add sterile substances to the cell culture. These control experiments have never been carried out. The measles virus trial in Germany meant that Dr. Lanka had commissioned an independent lab to perform the control experiment. The result, tissues and cells died due to lab conditions in the same way they did when they come into contact with allegedly infected material. So cells die with or without a virus present. So the virus cannot be the cause of morbidity. Many health experts say there are only 2 causes of disease: deficiency and toxicity. For example, Charlotte Gerson, daughter of Max Gerson of the Gerson Institute, great guy, said removing cells or tissues, cutting them off from the body that gives them their energy supply, quickly leads to deficiency. Injecting antibiotics into the tissue brings toxicity. So there is no proof a virus causes disease when there is existing deficiency and toxicity present. This misconception started with the cell theory of Rudolf Virchow in 1858. It's a bit like what Colin was talking about in smallpox a few weeks ago. The smallpox virus was just made up of all sorts of weird ideas. He proposed that all disease and all life starts in a single cell, but is hijacked by a virus that weakens the cell and multiplies. Before 1933, scientists in Germany contradicted this theory, but were silenced by the eugenicist regime of the Third Reich. By 1954, the virus became known as a malignant genotype inside proteins. Since 1954, the death of tissues and cells in a test tube has been regarded as proof that the virus exists. Today's scientists are missing out on the important second step of isolating the virus. If you can't isolate the virus, you can't prove anything. Because what is thought to be an invading virus could easily be an exosome produced by the body itself. Interesting, there are no electronic microscope images of the SARS-CoV-2. Any electron micrographs produced show normal particles from dying tissue and cells. Most photos you see, you won't be surprised on the media, they're CGI, they're computer generated. So with COVID-19, molecules are taken from particles of dead tissue and misinterpreted to be part of a virus. The consensus process where scientists agree with what items belong to a virus has been curtailed with COVID-19. A computer program can create any virus by putting nucleic acids from cells into an arrangement of a larger genotype that is then declared to be the genome of the new virus. So a DNA sequencing that doesn't exist in reality is invented and never subject to rigorous testing or isolated. So COVID-19 is claimed to be a novel coronavirus, but there's no electron micrographs to back it up. There is no verifiable image of viruses. Instead, we get CGI, and are told not to question the authorities. Dr. Lanka also says our lack of understanding about virus and disease immune systems is exploited by Big Pharma, who push dangerous potions called vaccines into us, e.g. a mixture of dying tissue, monkey cells, bovine fetuses and toxic antibodies are used as live vaccine. It's injected into children and elderly, into the muscles, in a quantity which, if it was put into a vein, would lead to death very quickly. This virus misconception has been around a long time. This is a crazy time where fearful, mask-wearing people have submitted to the police state. It's also a time to wake up for people before it's too late. It's good to question government policy because we can see through the veil that leads to the truth. So I hope you'll all continue to do your research and look into these areas that I've raised. Thank you for listening. Thank you.